So you decide to bring a beautiful child into this world, and mom and kid, you got to make sure that all the health care is right. It's on point. You got to get
Mm.
the baby seats. You got to get the right pediatrician, the right OBGYN, where you're going to have the kid. It can be crazy. When you need
Mm.
access to care as a mom or as a newborn, you need to get in touch with the right people.
That's right. And we're talking about the Health Plan of Nevada. And we have a beautiful nurse joining us right now, Katie Neese. She's not only an RN, but she has a CCM and a CLC. She's also the manager of clinical quality for the Health Plan of Nevada. And welcome to the show, Katie. Great to talk to you.
Great. Thank you for having me.
There's so many decisions to be made when it comes to bringing a child into the world, and it's critical that these decisions are made well. So tell us a little bit about the maternal care that you offer.
Yeah, great. So, first and foremost, the most important thing is if you think you're pregnant, you need to call your OB doctor, schedule an appointment. If you don't have an OB doctor and you're an HPN expectant mother, please contact our member services. They can help you find a doctor that's close to your home. They can do a search based on your zip code. Also, if you have preferences for gender, male versus female, or maybe you're looking for an alternative type of delivery with a certified nurse midwife, we have lots of options, including language preferences. If you're more comfortable with a Spanish-speaking physician, we can accommodate that. So let's get you connected with someone you feel comfortable with and early. We also offer for pregnant moms when they establish their first prenatal care in the first trimester,
Mhm.
and they attend their postpartum visit. We have healthy pregnancy rewards to help with some of those baby costs. Babies are very expensive. You have car seats,
Yes.
cribs. So by attending those visits, we have healthy pregnancy rewards that you can earn, and we'll send those to your house. We also send these cute little onesies to our moms after they
Cute.
attend a postpartum visit. So those are just some of the great services that we have for our
That's
pregnant
really,
moms.
really cute. And it's worth noting that, in some situations that you could be a high risk mother and you can help with the extra care that's involved there as well.
Sure. Yeah, that can be very scary. So, anyone that's a
Mm.
high risk mother, I would encourage you to get involved in our pregnancy case management program. And that is a team of trained OB nurses. They will work with you from the beginning of your pregnancy all the way up in time till the time you deliver and even postpartum. And they're really there for you to help coordinate your appointments, any medications, if you have referrals to specialists. They review signs and symptoms of labor, when to go to the hospital, and also encourage and support breastfeeding. One of the benefits that HPN offers to all of our moms is we provide a double electric breast pump, and it's free. Also,
Oh,
case
wow.
management, that program is free too. I want to make
Yes.
sure. Um, so we ship the breast pump right to mom's home. They don't have to go out in the community. They're not exposing themselves to anybody. Um, and we just want to make sure that they have all those needs met.
Mhm.
That's great. And, speaking of exposing themselves to anybody, that is kind of the elephant in the room right now, isn't it? For, expecting mothers, is that we are in the middle of a pandemic. And I know that, that's probably changed the way that you've approached care. Are you recommending that people, try to stay out of the office, try to stay out of the hospital and do more telehealth visits? Or how is this affecting mothers?
Sure, that's a great question. So we at HPN encourage and strongly recommend mothers must attend their prenatal appointments in person. That is just one visit, unfortunately, that it's not best to use as a telehealth visit.
Yeah.
Um, so continue to see your OBGYN in person. However, there are things that come up in pregnancy that you can use telehealth. So you're minimizing your risk of exposure. For example, maybe you need a refill of your medication. You don't need to go in the office to do that. The doctor can do that over the phone. The same thing with like test results. If you're waiting for your test results, they can do that through telehealth.
Mhm.
Um, and then also, we live in Las Vegas. It's allergy season. So, cold season, we have our Now Clinic, which is the telehealth service for PCP services. Those are great opportunities to utilize telehealth during pregnancy, but your prenatal care visits really need to take place in person.
No question. Before we go, a
Mhm.
couple things for not only the soon to be moms or parents and first time moms or parents. There's a new tummy to toddler mobile app. What's this about?
Yeah, so app is the generation, right? Everyone's moving towards apps.
Wellness, yeah.
So we developed this app, and it's for moms, and it's really from conception all the way through birth until the child reaches 2. And it's just resources. It has my baby's the size of a pea, and now it's a peanut, and now I'm an orange. Walking them through all those milestones, talking about when they're going to find out the gender of their baby. It has a reminder in there for women to get their vaccines. There's 2 recommended vaccines that all pregnant women should receive with each pregnancy. Flu vaccine, it's flu season. Get your flu vaccine before the end of October. And then the second is the Tdap, and maybe you don't know what that means. It's for pertussis, which is whooping cough. When mom gets that in 3rd trimester, she's not only protecting herself, but she's also protecting her baby. So it has those little reminders. It's overwhelming. I mean, I remember when I was a first-time mom, I wasn't a nurse. So all those little tidbits to help you and make sure that you're healthy.
No question.
Katie, thank you so much for joining us today. Appreciate all your insight and wisdom on motherhood and giving birth. Thank you so much.
Thank you for having me.
All right. If you want to learn more about Health Plan Nevada, their website right there on your screen. Health Plan of Nevada, a proud sponsor of the Morning Blend.